Dave, why don't you tell us what's going on, what started this, and why are you doing it, and what does it mean?
Sure. Well, thank you, Elizabeth. This collaboration is, I think, one of the most important things Kaiser Health News does. It's a way to get outside of the Beltway to cover a story that's really local in its core. Health policy is really boils down to people's interaction with their doctors, their hospitals, their insurance companies. And for a DC-based news organization, Kaiser Health News, and NPR based here, I think it's very important to get into the community. And what we're going to talk about today is how we've done that through this collaboration. But first, a little bit about Kaiser Health News. I wanted to give you a quick overview. We started Kaiser Health News about 5 years ago in June of 2009, so about exactly 5 years ago. And it was a really proportionate, I think, fortunate time to launch a health news service. June 2009, if you might remember, was when Congress started debating the Affordable Care Act. And a lot of news organizations across the country had downsized, and some of that downsizing involved losing expertise in health reporting and health policy reporting. So I think we had some strong tailwinds to help us with a lot of interest in media partners in covering what became a really big story for a lot of news organizations. We provide in-depth coverage of health policy issues. The Affordable Care Act is probably the biggest health policy issue over the last 5 years, but there's many other issues that we look at, as you can see from the reporting that we have. Our primary distribution strategy from the start was to work with other media organizations, many of which are public media organizations, are some of our best and strongest partners like NPR. But we really started with an approach to try to build out a distribution network that would let us get our stories out to other places.
It was our idea to do it in a way to work with member stations to increase, the first thing was to increase local capacity to cover this unbelievably important story. And we started this in the year that the law passed. So this was, or took effect, I should say. And it was an unbelievably important time. And I think stations, newsrooms are not exactly full of reporters. Some of them, even the big stations, I don't know if Laura Walker's still here, have maybe 5, 6, 8 reporters, you know, even big ones. And a lot of them had, this is one part of their beat and something else is one part of their beat. So we really wanted to help them cover this story locally.
So about 2 years into the project, came implementation last October 1st, which, hit everyone pretty much by surprise that it was such a big mess. But during the first 2 weeks, we were able to put on all these stories from the field, in addition to all of the stuff that NPR's staffers were producing. Just dozens and dozens of stories. Each show had 2 or 3 or 4 stories. And this gave us a more complete picture of what was going on out in the country, helping us to, as Laura Walker said, sound like America.
I'm going to talk to you about 3 projects real quick, if I can. This is the one that won the Pulitzer last month, and we just picked it up last week in New York. I just will go over quickly what it was. It's a story. We had a reporter working for a year on it, 28-year-old guy who came in as an intern, great reporter. We started this with NPR, is what I was thinking, with Howard Burkus. We found that black lung disease was soaring. We all think it's going away, and it was soaring. That was the project we did. But he kept going back to coal country and finding out all these miners can't breathe, they're on oxygen, and they can't get any benefits. And again and again and again, he said, well, why can't you get benefits? Well, there's these doctors at Johns Hopkins University and this law firm, and they go into court against us and prevent us from basically getting any benefits. These are hundreds and hundreds of miners. So he collected 1,500 medical records from the families, and we started going through it. The day the story came out, Johns Hopkins suspended their program. They were embarrassed by it, as I think they should have been. Our partner was ABC. ABC did a great job on television with an evening nightline and on the evening news, which was really good. This is a data visualization. You can't quite understand it, but if you run your mouse over any of those dots, they pop up a case. Those are 1,500 medical cases of people with black lung. The doctor on the left, Dr. Paul Wheeler from Johns Hopkins, said, oh no, they don't have black lung. Those are all doctors in the same cases who all said, yes, they do. And when we showed that to Johns Hopkins, that's what led them to change it. Some of the impact, the Labor Department jumped in immediately and started changing the way miners get their benefits. They issued a report, and usually when the government issues a report, they don't put the name of the news organizations in the top line when they're making orders, but they did in this case. And it's had the effect of miners now getting benefits. And that's a really good thing, and I think that's why it was honored, and it won a number of other awards.